Most people think of Cialis as the weekend pill for erectile function, but in bodybuilding and athletic circles, prescription Tadalafil and its underground cousin Amino Cialis have earned a very different reputation. Now, athletes talk about it for bigger pumps in the gym, better recovery between sessions, and even possible benefits for kidney and heart health. I am Dr. Dwayne Jackson, resident science guy here at the IFBB Pro Ask Me Anything podcast. And today we are going to deep dive into the science and speculation behind these two compounds. We'll cover how they work, what makes them different, and how they're actually being used in fitness circles, and the benefits and risks beyond sexual performance. Now, before we get started, make sure you follow the IFBB AMA podcast, subscribe to the IFBB AMA YouTube channel, and follow at IFBB AMA on Instagram. You can find me, Dr. Dwayne Jackson, at DRDN Jackson. Tag me with your questions and I'll tackle them in a future episode. Now for the medical disclaimer. This show is for education and entertainment purposes only. Tadalafil is a prescription medication. Amino Tadalafil is unapproved, has no published human safety data, and is often sold illegally. Nothing here is medical advice. Always work with a qualified healthcare provider before starting or changing any medication or any supplement whatsoever. Okay, so let's start with Tadalafil and what the heck is this thing. Well, it's better known by the brand name Cialis. Now, it's sold online as a research chemical or a peptide, but that's just marketing language. The big difference is that while Tadalafil has decades of clinical research and established dosing, Amino Tadalafil has no peer-reviewed human data whatsoever. We don't know its exact potency, its half-life, or really its safety profile. So let's talk then about its pharmacokinetics and some hypothesized differences between the two. So Tadalafil's pharmacokinetics are well characterized, like I mentioned. Has a half-life of about 17 and a half hours, which then allows for a long drug duration of action, which is up to 36 hours. This is how it earned the nickname the weekend pill or the weekender. After an oral dosage, peak blood levels occur in about 2 hours, and food really has a minimal impact on its absorption. It's primarily metabolized by the liver, and its breakdown products are excreted in both urine and in feces. Now, amino tadalafil, on the other hand, has no published pharmacokinetic studies in humans, so we can only make educated guesses based on its chemical structure. We don't know. And that's why any claim that amino tadalafil is faster acting, longer lasting, or whatever they say, it's purely anecdotal at this stage, and you're just listening to the bros let you know. Now, let's talk about this then in common dosing among the fitness industry, fitness circles. So what is happening in bodybuilding, athletic communities, and everything else? Well, the first pattern that I see out there is what I call pre-workout boosting. So this is where athletes will take prescription Tadalafil at 10 to 20 milligrams about an hour, hour and a half before training. Now, the goal here is maximum vasodilation during the workout for bigger pumps, better nutrient delivery, and possibly more endurance. This approach is usually reserved for those big training days like legs, back, or chest, or for events like photo shoots where we want to get the vascularity up and everything else, but we're probably a little carb depleted and maybe dehydrated at the time. Now, the downside is that for some people, they'll experience flushing, some headaches, or a drop in blood pressure that then can hurt performance down the road. And remember, gang, having more dilation does not mean better performance. This is a complete misinterpretation of true physiology. We only have 5 to 6 liters of blood to go around. And if we dilated all of our vascular tissue, most of the blood would end up in our legs, especially for big bodybuilders. And if that were the case, we wouldn't have any venous return back to the heart and then pumping that stuff back up to the brain. So you go horizontal, pass out, and then that way you take away the effects of gravity, drawing blood downward, and then you bring it back to the brain. So we don't want that to happen. We don't want blood pressure drops. So do pay attention if you are mucking around with this stuff, the higher dosing especially, because if you feel faint, you're probably not improving your performance anyhow. Now, the second pattern that we see out there is low dose daily microdosing, if you will. This means taking 2.5 to 5 milligrams, kind of like prescription, every day to maintain steady PDE5 inhibition and constant vascular support. The theory is that smaller, more frequent dosing gives steadier effects and fewer side effects, especially if amino tadalafil's PK is different than tadalafil. But the reality really is that we don't know. Without verified potency, you could be underdosing, overdosing, whatever it may be, and purity is always going to be some sort of a concern. The main mistakes in anything I see in the current industry is chasing pumps with higher dosing because of this reason. So, and also in ignoring hydration and electrolytes and really trusting the underground products when not knowing their content. So in bodybuilding, as always, the smartest approach is going to be lowest effective dose, timed for your goals, with an emphasis on maintaining performance and recovery and not just chasing the pump in the mirror or the vasodilation. We want to make sure we're getting that blood around where we want it to. We want to make sure we're getting enough of it around. Pressure is going to be important. Okay, so let's now talk about blood flow, pumps, and muscle growth and what we've heard in the science and what we know. So the reason why bodybuilders are interested in PDE5 inhibitors really comes down to blood flow. I've probably driven that home enough today. Now, in skeletal muscle, this means more oxygen, glucose, amino acids delivered during training, and more metabolic byproducts like lactate and those kind of things being taken away and cleared more efficiently. But the anecdotal feedback from lifters and bodybuilders is pretty clear. Pumps are fuller, they last longer, and may translate into bigger training stimulus. So think of it like upgrading from a two lane road to a 4-lane highway for blood flow and nutrients. Still have to drive the truck, but the deliveries happen faster and more efficient. Now, let's shift gears away from performance enhancement and talk more about health and especially some important health aspects that, bodybuilders and athletes, strength athletes are most concerned with. This is interest in kidney and cardiovascular health. So PDE5 inhibitors can improve renal blood flow and reduce oxidative stress in the kidney. Now, on the cardiovascular side, tadalafil is approved for pulmonary arterial hypertension, where it lowers pulmonary artery pressure and then improves exercise capacity. It also improves systemic endothelial function, which may actually support long-term vascular health. And overall can reduce blood pressure variability, all are which are pretty attractive from a performance and longevity perspective. There's also been shown that in altitude performance studies that there's improved oxygen delivery in hypoxic conditions. So if you plan on climbing any mountains anytime soon, you might as well do it with a boner. Anecdotally, some athletes do report less delayed onset muscle soreness and faster vascular recovery when using low dose tadalafil regularly. And this is likely due to increased nutrient delivery and metabolite recovery. So now, when we talk about risks and legalities and underground use and everything else, with prescription tadalafil, you have known dosing, you have regulated purity, you have decades of safety data. And I mean, this stuff is everywhere. And in fact, and don't quote me on this, gang, but like most times this stuff's not going to even be faked because you can get a prescription for this stuff pretty darn easy. So, you know, not a big deal. And there are some rare but serious side effects like priapism, sudden vision or hearing changes, and those dangerous drops in blood pressure that I mentioned, especially if you combine them with nitrates. So if you have heart problems, you have to take a nitrate. You might have some problems. So don't be taking nitroglycerin or be taking in a pile of nitrate vasodilators that, for supplementation or whatever when you're taking this stuff, because you may find that blood pressure gets a little low. Now, that's tadalafil. Now, amino tadalafil is a completely other story. There's no human safety data, and there's no guarantee on purity. And really, the whole idea of underground production raises the risk of contamination and mislabeling, which really does make it a gamble with your health. When we look at this in application, in bodybuilding, tadalafil is often used to enhance those pumps and potentially aid recovery. Some use it for daily, to get those steady state vascular effects, while others may time it pre-workout. In contest prep, it can help maintain some vascularity when those carbs and body fat are low and we're a little dehydrated. But overall, the catch is that pumps don't equal muscle growth. They can enhance the training stimulus, but only if your nutrition, recovery, and progressive overload are on point. PDE5 inhibitors can only be one piece of the puzzle, but they're definitely not going to be a replacement for the basics. Get those down first. Otherwise, you're just going to get, a good time in the sack. With amino tadalafil, all the potential benefits are going to be theoretical. They lack human data, which means you're flying blind. And if you're considering any PDE5 inhibitor for performance, the safest path, like I said, is going to be prescription tadalafil. And that's my opinion. You guys can have yours, but I just, like I said, this stuff's around like candy, not hard to get. You can do it under medical supervision pretty easily. And if you take some careful attention to hydration, electrolytes, and dose timing, it can work very effectively and very predictably. So really, Cialis isn't just about the bedroom. It's about blood flow. It's about vascular health. It's about possibly enhancing your training environment. But prescription tadalafil and underground amino tadalafil are two completely different animals. One is clinically studied and predictable and pretty much everywhere. The other is untested and maybe unpredictable. So that ends it, gang. That's it for tadalafil versus amino tadalafil. And like always, please follow the IFBB AMA podcast, subscribe to the IFBB AMA YouTube channel, and follow at IFBB AMA on Instagram. I'm Dr. Dwayne Jackson. My handle is at DRDN Jackson. You can find me on Instagram quite easily. Send me your questions and I'll break them down for a future episode. Until then, stay healthy and stay sweaty.